Today we are going to talk about certain basic aspects of the bone marrow procedure.
First of all, we're going to talk about where the bone marrow is located in the body, then where the biopsy is usually taken from, how the biopsy is done, whether there are any guidelines with regard to the bone marrow biopsy, what can go wrong during the procedure, and yes, whether this procedure is painful or not. So let's start with where the bone marrow is located throughout the body. From birth to about 25 to 30 years of age, all bones have bone marrow, but thereafter, only what are called the axial bones, such as the skull, vertebrae, ribs, and the pelvic bone or hip bone, contain marrow. Most of the times, the bone marrow is collected from the pelvic bone and only rarely from the sternum.
So here I have a full-size replica of a pelvic bone. Okay, so this is the front, the pubic bone. This is the back, the sacrum, and these two are the iliac bones. And the biopsy itself is done from here, the posterior superior iliac spine.
As I have already mentioned in this picture, the biopsy, actually only the aspiration, can also be taken from the sternum. And that's why it should never be done, because it's only an aspiration without a biopsy, and one has to take both. And also because right under the sternum is the heart, which makes it a very dangerous procedure.
How is it done? Let's pretend that this is a bone. So the carton outside is the solid part of the bone, the cortex, and inside the soap is the soft bone, which contains the bone marrow. So the operator inserts the needle until the tip goes through the cortex or the solid part. Once it's in the cortex, the operator removes the stylet and then keeps pushing the needle inside the soft part of the bone. Okay? And there are some striations here which are 1 centimeter apart because we need to collect a certain length of the core. Okay? In addition, the operator is capable of measuring how much core is inside by using this sound. So at this point, I have roughly 1 centimeter of core, well in this case soap, true, inside the core, which means that I have to push a little bit more because I need to take at least 1.5 centimeters of bone marrow biopsy. So I just pushed another centimeter, and then let's see how much bone marrow we have here. Okay, now we have a little bit more. Okay, so we have basically 2 point something. Now this special needle actually has a coil at the tip, which is actioned by this lever. Now I locked it. Now I remove the needle out. I unlock it again, and from the other side I'm going to push the biopsy, in this case the soap, out, and here's my biopsy.
Next question we're going to address is whether there are any guidelines with regard to the length of the core biopsy. And yes, in this book, the WHO classification of the hematopoietic tumors at page 17, there is a picture there, and underneath there is a specification that the core has to be 1.5 centimeters or longer in length. So what can go wrong during the procedure? Well, in the hands of an experienced operator, the procedure is rather safe. In a study done by Dr. Barbara Bain, a hematologist at St. Mary's Hospital in London, UK, a study comprising more than 54,000 bone marrow biopsies, only 26 adverse events occurred, with only one death because of unstoppable hemorrhage. And here is a breakdown of all the adverse events noted in this article. The question that is in everyone's mind when thinking of a bone marrow biopsy is whether this is painful or not. Well, let's see what the famous Dr. House has to say about it.
Please stop. Please, you're not right. Sorry. I need a lot more. No, stop! Stop!
Now, what happens in this episode of Dr. House is a gross misrepresentation of reality. The procedure can be done either with local anesthesia or what is called monitored anesthesia care or MAC sedation, also known as conscious sedation. With local anesthesia, the procedure can be anywhere from a little bit of a discomfort all the way to very painful, really depending on how sensitive the pain the patient is and on how skillful the operator is. Now remember that with local anesthesia, only the skin and surface of the bone are numbed, while the inside of the bone cannot be reached by local anesthetic. Conscious sedation, on the other hand, eliminates the pain completely since the patient goes to sleep and wakes up 30 minutes later without remembering anything. Conscious sedation is also advantageous for obtaining a good specimen since the operator has the time and peace of mind to obtain whatever is needed without making the patient uncomfortable. To recap what we talked about today is where the bone marrow is, where the biopsy is usually taken from, how the biopsy is performed, whether there are any guidelines, what can go wrong, and obviously whether this procedure is painful. And that's it for today.